Your healthcare provider has determined that you will participate in a home sleep apnea test. The Cadwell ApneaTrak will collect data on your breathing and snoring while you sleep. A qualified sleep technologist should have already attached the electrodes to your scalp in the correct locations. Keep the electrodes in the locations they were placed. If any electrodes pull off, you can often push them back into place or call your medical provider for further instructions. If your provider gave you specific instructions, follow those instructions first. As you prepare for your home sleep test, please check the contents of your kit. Verify you have the ApneaTrak, a chest effort belt with a blue connector, the abdomen belt with a yellow connector, an airflow cannula with clear tubing, an adhesive airflow sensor with a gray connector, an adhesive snore sensor with a purple connector, an oximeter finger sensor, adhesive tape, and the patient instruction manual. If your provider has already sized the belts and connected them to the device, skip to the chapter Wearing Your ApneaTrak. To remove the port cover, press on the arrow and slide the panel down. The sensors are color-coded to match the connection ports on the ApneaTrak. Connect the blue input from the chest belt cable into the blue port. Connect the yellow input from the abdomen belt cable into the yellow port. Connect the gray input on the thermal sensor cable into the gray port. Connect the purple input on the snore sensor cable into the purple port. Connect the white input from the EXG cable into the white port. Plug the black connector from the finger oximeter sensor into the black port. Replace the port cover. Place the abdomen belt around your belly button and stretch it so that the belt is snug and comfortable. Fasten the belt by pulling the hard plastic button through the nearest slot in the belt. Place the chest belt around your chest so it is snug and comfortable too. Slide the ApneaTrak to the center of your chest. Remove the adhesive backing from the thermal sensor. Stick the sensor on your face so that the notch at the top of the sensor sits just below the center of your nose, and then tuck the wires behind your ears. Holding the cannula with the prongs facing towards you and curving down, insert the ends of the prongs into your nose and pull the cannula tube back over your ears like a pair of glasses. Slide the tension adjusters up the cannula tubing. Tear off 2 small pieces of tape and secure the tubing to your cheeks. And attach the cannula by gently twisting the tube onto the metal connector on the top of the ApneaTrak. Remove the adhesive backing on the snore sensor and place the sensor against your neck. Push to ensure the sensor is secure. Use additional tape if needed. Remove the paper covering the adhesive on the oximeter. Place the oximeter finger sensor on the index finger of either hand, with the cable running up over the back of your hand. Wrap the sides down around your finger and fold the bottom side up and wrap the sides up to enclose your finger. If the cable hangs loosely, tape the oximeter cable to your shoulder and elbow. If there is no slack, tape it just to your hand. If your provider set an auto start time, you don't need to do anything to start the recording. Just go to bed and the device will start at the correct time. If your provider instructed you to hold the button to start the recording, then press and hold the raised Cadwell logo event button for 3 seconds until the recording REC indicator LED on the ApneaTrak appears. The LEDs will then turn off, but the recording has been activated. If any cable disconnects, simply plug it back in and the recording will continue. To record an event for review, press the raised Cadwell logo event button once to mark an event in your sleep study data. Write down the time and the reason of the event for your physician to review. To check if the device is recording at any time, push the event button and the recording LED will illuminate for a few seconds. If you feel uncomfortable, you can move the ApneaTrak to either side of your chest, but please leave it on the front of your body to correctly record your body position during sleep. Please refer to the patient guide provided with your ApneaTrak system if you have any additional questions on setting up the system. If you need to use the bathroom, remove just your oximeter finger sensor. Wash and dry your hands, and replace the oximeter finger sensor when you're done. The recording will end automatically. You can remove the sensors in any order. If you were instructed to use the ApneaTrak for more than one night, use a new kit or use all new sensors. Follow the instructions given to you by your provider to dispose of the accessories, or put everything back in the case and return it to your provider. Thank you for watching this ApneaTrak patient instruction video, and good night.